Hey, it's Dr. Josh, and if you're watching this video, chances are you hurt a rib, you felt a pop while doing jiu-jitsu. So what we're going to do in this video is going to show you the entire process and things to watch out for when it comes to rib injuries sustained in jiu-jitsu. They're really important to take care of because they affect all movements, a lot of crunching, a lot of framing, a lot of types of core movements in jiu-jitsu, and they just hurt, especially when somebody hugs your head, they have knee on belly, chest to chest, anything like that, or just playing guard in general. It just hurts, and it's really important that you treat it properly in order to get around to rehab and to get back on the mats as fast as possible, because if not treated right and properly, jiu-jitsu rib injuries and that pop can linger around for months on end. And they can typically take around 2 months to begin with, maybe a little bit less, but if trained or treated improperly, they can linger around to 3, 4, 5 months that I have seen. So first things first, number one, let's talk about diagnosis and the proper assessment. You're going to want to see somebody who knows a little bit more information about this, right? That's probably why you're watching this video. Whether it's a physical therapist, a chiropractor, your medical doctor, anybody who can diagnose it right properly. Some people don't have the skill set to diagnose it properly, and that's okay, but maybe you have to go down the line. Maybe you have to go somewhere higher, to an x-ray, to an MRI, to a CT scan. Those are typically the 3 gold standards to assess these types of injuries, to see how good or how bad they are. You really want to make sure that you have the proper diagnosis, because you want to know how to treat it properly, right? If you have a fractured rib, you're going to want to take some time off. If you popped the rib and tore a little bit of the cartilage and it's not that bad of a deal and it's very mild, that's probably not going to show up on x-ray, but you're going to want to know how to treat it properly. Second thing that you're going to want to focus on is pain management options. And of course, when it comes to pain management, that includes everything from relaxation to rest to ice protocols. I typically find that most people with rib injuries feel better with heat. I know that the traditional ice for the first 24 to 48 hours is really common, but I just find that treating so many rib injuries in jiu-jitsu that most people actually feel better with about 5 to 7 minutes of heat. Because it's right here and in this location, right, what you may want to focus on is only 5 to 10 minutes of heat. It is very close to the heart, so I really wouldn't want to treat or heat that area for 5, 10, 15, 20, 30 minutes, right? You want to just stay in a very limited time. Other pain management options are actual soft tissue treatment. In the office, I do a lot of ART or Graston. We want to get things mobilizing and get some blood flow in there. Of course, you're going to potentially want to do kinesio taping and some taping to help stabilize that injury. And so if you have a popping or clicking and it feels a little unstable, you really want to kind of minimize your movements, and you want to minimize that through whether it's rest and relaxation, or it's through taping and pain management. So that's your second option, is pain management. Number 3 is to potentially stop causing more problems to it, right? So if we say, hey, it's starting to feel better after 4 or 5 days, and you're starting to maybe I can go back to overhead pressing, and you feel a strain, and you pop it up from like a 5 to a 7 to a 10, obviously any type of injury, including a rib injury, if you're starting to go over, in my opinion, a 3, 4, or 5, pretty much over that level, depending on your pain level, you're starting to increase your pain and cause more irritation to it. So anything that increases more pain and more discomfort within the rib cage, I'd probably avoid temporarily, so that you can actually start and jumpstart your healing process. Number 4 is to stay active. Contrary to what most people say, is that rest is best. Rest is actually not best whatsoever. So for certain people, staying active might be walking, it might be riding a bike, it might be doing some leg presses or something like that. But anything that you could do to stay active and help mobilization will help your body recover faster. Mentally, physically, spiritually, socially, blood flow wise, everything is just better if you stay a little bit more active. And again, going back to the last step, is as long as it doesn't re-aggravate and re-injure things, that's okay. So if you have to do, let's just say, a leg press, for example, and instead of doing 200 pounds, you might only do 80 pounds just so that you don't have to brace your core as hard and you don't have to lift things as much. It's better to get something in than to get nothing in. So you really want to stay active, and this will bleed a little bit over into the next section. So part of staying active includes number 5, which is rehab, right? We want to focus on mobility. We want to do thoracic spine movements. We really want to start focusing on diaphragmatic breathing, deep breaths to get the ribs to expand and contract while still certainly bracing the core, but not overly bracing it. We may want to do a modified or mild dead bug or side planks. We want to modify, right? We want to see where we're at. We don't want to just go into a full-blown plank because that might cause too much pain. So we may want to start with planks on our knees for 10 or 20 or 30 seconds. And then if we can hold that, maybe we kind of do that more often throughout the week instead of trying to just say, oh, well, this is easy, let's go up to the next level. I would just stick with a modified rehab program very, very lightly. And remember, you can always work other areas. If you can do bicep curls or tricep extensions or back stuff, it's always good to do back and other areas because it does help your breath and stuff like that. But you do want to do thoracic spine mobilizations. Diaphragmatic breathing, as I said before, is probably one of the most important things to start right away. I would also avoid, as I said before in step number 3, to stop re-aggravating it. I really don't like overstretching the rib cage. A lot of people try to overstretch it, and if you kind of pop it or have disruption to the cartilage, these fibers can no longer start to heal if you keep tearing them apart. So it's really important to stabilize the injury before you start aggressively stretching it. So keep that in mind when you're doing your initial phases to your rehab. So the next part is number 6, and we talked about rehab and staying active, is to add more advanced rehab, right? Now that you're doing more linear stuff in like just one plane of motion and you're holding that, which is what we call isometric stuff, now maybe you want to do more challenging rehab. Maybe you want to do more rotational stuff. Maybe you want to do more side bending stuff, assuming you are able to do this, right? And you're probably not going to be able to do this for maybe 3 weeks out, 4 weeks out, 5 weeks out, or something like that. So basically, you're going to do more advanced rehab process, wood chops, rotational stuff, Pavlov presses, wood chops from this direction, and you're going to do more rotational stuff and lateral bending stuff, not just stuff in what we call the frontal plane and just unilateral movement. So we're going to start adding different movement patterns to this, and your advanced or your rehab is going to look a little bit more advanced in this stage. So or anywhere between 4 and 6 or 8 weeks, depending on how you're healing. Finally, in the last stage, you're probably already starting to do some drilling, but you may need to do some drilling at this point, right? So you're back on the mat. You may have to modify your schedule when it comes to your rib pain, right? So we know that when you're having rib issues, being on the bottom is going to be tough. Doing aggressive crunching is going to be tough. Framing off of people and inverting is going to be very, very difficult on the rib cage. So knowing this right off the bat, you're going to maybe have to train, instead of training for an hour and a half, you may train for 45 minutes. You may have to pick a lighter partner. You may have to go with maybe a heavier partner, but somebody you trust. And you may have to play more top game, which is probably going to be my recommendation for a little bit while anyway. So, and in the times that you are resting, so to speak, off the mats, you're going to be doing some rehab, or you're just going to be relaxing. You're going to be focusing on your deep diaphragmatic breathing at all times. And it's going to really just depend on your training partners. It's going to be training for yourself. Maybe one day you wake up really, really early and you like feel really stiff because it's cold outside or whatever, the rib's cold. And then another time you're going to wake up and feel great. Okay, so just adjust your training schedule and your training program and give yourself some flexibility when it comes to rib injuries. I think it's really, really important as a bonus tip to make sure that you're getting the proper treatment. As I said before, that's pain management options, scar tissue release, Graston, ART, whatever it is, mobilizations. It's really important that you stay active and do all these things in pretty much the order that we talked about. Because if you skip from, like, let's just say initial injury to pain management, and you're like, hey, I feel a lot better, and then you go right to advanced rehab or right to training, you're probably going to likely go back, and those types of rehab protocols are not going to work, and you're going to have this lingering issue for a while. I just want to give you my advice on this because I do see anywhere between 1 and 3 new cases of rib injuries or I have 1 to 3 new people asking me new questions about rib injuries every single week. And it's just not common for a lot of practitioners to know about them because they're pretty rare, but they're kind of common in jiu-jitsu. But at the same time, they're not well managed by the medical community, and it's really, really hard to manage these because they do linger around. So keep this in mind when you're going back and you're retraining and you hurt your ribs and you really want to start getting through this cycle of getting out of pain and back on the mat. So that's how I would treat your rib injuries. So if you have any questions, feel free to reach out. And if you like this and you found this valuable, please subscribe to our channel. It really does help us, and I would appreciate it very much. So thanks again, guys. See you on the mats. See you soon. Bye.